Welcome to QD Clinic, brought to you by Room Now Live. Today our case is about medication reminders. A 67-year-old Hispanic woman has rheumatoid arthritis, fibromyalgia, bronchiolitis, osteopenia, Sjogren's syndrome. She's taking methotrexate and Xeljanz and prednisone, and I got a problem with compliance. When I asked the patient about compliance, she's never really quite sure, especially about how she takes methotrexate. 7 pills once a week, 7 pills a day. Again, she seems to not really ever know. So this has become a major problem for her because her disease is really out of control, and I don't know what my next move is if she's not compliant. Compound this problem by the fact that she's a victim of polypharmacy. She's on 13 medications for a number of other medical conditions, and everybody just seems to be piling on the medicines the more she complains. So the question is, how do you get this patient to be compliant? The first measure, of course, is to review medications at every visit. What we do is, and found to be really effective, is we print out a copy of the patient's medication list prior to the visit, and we hand it out when they check in and they fill out their survey question. We do survey questions in our clinic. They look something like this. But we put on that a medication list and ask patients to confirm or change their medicines. That sort of shows an aptitude and an understanding about the medicines that they're on. In a patient like this, we always demand that they bring their medicines, not a medicine list. Everybody must bring either a medicine list or all their medications to the visit. In this patient, we've been demanding for the last month or two to bring a medication list to every visit. And you know what? She sometimes does it, but still we have a concern. And then what are going to be your other measures? In this particular case, what we did was we decided we were at a crossroads. We have to make a critical decision on therapy. I need to know she's getting methotrexate. I changed her to parenteral weekly methotrexate and had it done in my office. She had to come in every week. We're going to do it for 8 weeks and decide if that's the missing link on why she still has 9 swollen joints. Someone's calling. The other options for you are a few. I think ours is a bit extreme. Beyond just bringing in the medicines and then having them come back and receiving the medicines in your clinic, that's not appropriate. I think that the rules are a few that you can live by. Number one, ask them how they remember to take their medications. They'll tell you a story that either works well based on your experience or doesn't work at all. Second, demand that they use a pill box and introduce them to either the daily pill box or a pill box that has twice a day or 3 times a day dosing that would work with their current medication list. Next is to involve the family. Having a family member who is concerned easily will fix the problem, as often they're more concerned about the patient taking the medicine correctly than the patient would be. And then you can also build in reminders into your electronic health record if you have a critical issue or the medicine might need a medicine once a week, once a month, that sort of thing. You can use the EHR to prompt calls to either be done by you or an assistant to remind the patient. And then lastly, there are a number of applications. In fact, on Apple Play and the iTunes store, there's over 500 applications designed solely for the purpose of medication reminders. There's a number of them that I jotted down. One's called My Meds, Medisafe Meds, DoseCast medication reminder, another one called Tab Time Vibe, meaning that the phone will actually vibrate when it's time for them to take their tablets. Again, the patient can enlist the use of any one of these if you think it's a minor medication issue. I had another patient last week where they were just forgetting to take their once a week Alendronate, and we talked about, link that Alendronate use to something you do once a week anyway, like getting your nails done, getting your hair done, shopping online, whatever it is that you do on the same day every week. Link that to taking a medication like Alendronate once a week. So compliance is really, really important. Oh, our patient, the one who was doing really poorly, who came in for 8 weeks of consecutive subcutaneous methotrexate, no effect. So we had to jettison her current therapy of Xeljanz and methotrexate and move her on to a whole new plan because she's got horrible arthritis. She has a CDI score of 42, 25 swollen joints, 8 swollen joints. That was at the last visit. We need to make a change, but at least we did the things to ensure excuse me, that that compliance was not the issue. I could edit that out, but then again, I want you to know I'm still alive. Lastly, Room Now Live, we just completed it yesterday in Fort Worth. Fabulous meeting, hundreds of people attended online, hundreds in the room. We're going to make that available to everyone online, on demand, starting next week, April 1st. Look for that announcement. Tune in tomorrow for more QD Clinic.